Thank you very much for your kind remarks. And let me thank everybody for finally being at this step now since we started. And again, I'm doing my closing remarks. And I want to start on another very serious note that I think all of you can see that I'm not having my mask off. When we started the meeting and all, it was on and off. And I'm not having my mask off because I got my results yesterday and I tested positive with COVID-19, but I am still capable of carrying out my responsibilities because I guess I'm one of those that responded early in the time to get vaccinated, and I had already completed my vaccination. But I do want Your Excellencies to indicate that this COVID-19 is no something that people can play games with. I think I managed to survive throughout this period, one, because I got vaccinated on time, as there was a call by President Cyril Ramaphosa and the government to get us all vaccinated, and also to call on our nations to also get vaccinated. But obviously, we are aware of some of the challenges that are accompanying the challenges of getting the vaccines, but also those who are feeling like they shouldn't be taking the vaccination. I'm here saying to you, it's important to get vaccinated, number one. But from my own practical experience, also, it's about ensuring that you live a healthy lifestyle as much as you possibly can. The things that are always, we are told we must take our multivitamin tablets, we must try and live a healthy lifestyle and exercise and do that is something that I do religiously in the best way that I can. But I don't want to undermine the effect and impact of this, even on myself, healthy as I was. It was 24 hours of difficulty, which I thought it was just a minor flu that then ended up being deeper than just the flu. And then yesterday I decided, well, maybe I should just go and vaccinate. I mean, I must go and check, especially because I didn't have all the other symptoms that we normally talk about, your temperature. I just had a scratchy throat, and then I had a cold, but I didn't have any temperature at all. And there I was. Today I got my results. So as a way of just opening remarks is to really plead with ourselves to make sure that we do the best that we can to protect our people, protect our population, communicate in the best way that we can, because it doesn't choose who you are, where you are. And we've got a lot of work to do. We go to our communities, we try to keep our distance, we try to stick to the protocols, but sometimes we let our guards down because we get to places and people are very excited in seeing you and bringing the services to the people. So there will be my comments in terms of just requesting that we all really do the best that we can. We are responsible for population and development, and the challenges that are faced by our people are very serious also. So, Excellencies, Honorable Ministers, PPD board members, distinguished guests of honor, dear colleagues and friends from UNFPA, distinguished participants, ladies and gentlemen, a very good afternoon to you all from South Africa, and a good morning and good evening to you in different parts of the world. A very warm welcome to you to the ministerial session on promoting South-South cooperation for attaining ICPD and Agenda 2030 of the 18th Inter-Ministerial Conference on South-South Cooperation in Population and Development. Every year, partners in population and development and the United Nations Population Fund jointly organize a ministerial strategic dialogue to discourse on the contemporary overriding issues. This we do with a clear intent to reflect on the findings and practically programatize them into our own strategies and work plans. This year's focus is on the achievement of the International Conference on Population and Development, ICPD agenda and Plan of Action for Sustainable Goals 2030 SDGs. Whenever we speak about ICPD, we mean the outcomes of the Nairobi ICPD 25 summit. Coming out of the summit, 8,000 delegates made 12,000 commitments and reached consensus to implement the 3 zones: zero unmet family planning, zero maternal death, and zero gender-based violence and harmful practices. I'm happy also that I'm speaking at a time when South Africa was actually hosting His Excellency, the President of Kenya, Uhuru Kenyatta, and I had the opportunity of being with the President and talking a little bit about, but I was saying that while we're doing so, we'll also hear how we can learn from respective national priorities. Due to time constraints, we are asking that you confine your statements within 7 minutes. We are greatly delighted that we have a distinguished array of high-level speakers in today's panel, and we are eagerly waiting to hear from them. I wish to thank wholeheartedly and pay profound tributes to Her Excellency Dr. Isi Toure, Vice President of the Republic of Gambia, who's present with us today. And our last board meeting is a great honor for PPD board. Your attendance signifies the importance that the government of the Republic of Gambia accords to South-South cooperation. And I know in the previous meeting that you had to rush somewhere and were delayed, but you did stay to make your statement, Your Excellency. Thank you very much. On behalf of the honorable board members, I wish to express our sincere appreciation to Honorable Carl Kendrick Chua, the Minister of Socio-Economic Planning of the Republic of the Philippines. Your presence here today is true witness to the interest that your government is having in our organization. We are assured that you and your government are committed to achievements of the ICPD and SDGs through South-South cooperation. I hope that the Republic of the Philippines will soon join PPD and become its 28th member state. I wish to express my sincere thanks and appreciation to the following ministers who are PPD board members who are participating today: Honorable Faisal Sultan, Minister, National Health Services, Regulation and Coordination, Islamic Republic of Pakistan; Honorable Dr. Leah Tadesse, Federal Minister of Health, Federal Democratic Republic of Ethiopia; and Honorable Dr. Yu Juejun, Vice Minister, National Health Commission, NHC, People's Republic of China, and thank you for being there all the time. My heartfelt thanks to His Excellency Ambassador Mr. I.B. Peterson, Deputy Executive Director, UNFPA, who is attending on behalf of Dr. Natalia Kanen, the Executive Director of UNFPA, who's always there with us. Your continued support of the PPD and South-South Triangular Cooperation is appreciated. I wish to take this opportunity to thank all colleagues in the Policy and Strategy Division of UNFPA for their exemplary collaboration with PPD Secretariat over the last 3 years. I'm very pleased to express my heartfelt gratitude to the following participants in today's section: Dr. Mohammed A. Sheikh, Director General of the National Council for Population and Development, NCPD, Republic of Kenya; Dr. Letitia Adelaide Apia, Executive Director, National Population Council, NPC, Republic of Ghana; Dr. Mustafa Hinin, Director General, National Population Office, NPO, Ministry of Planning and Development, Republic of Cote d'Ivoire; Dr. Sumaunawachai Watairi Chagarechai, Director General, Department Health in the Kingdom of Thailand, and apology if I didn't pronounce that surname properly; Dr. Nguyen Duan Thu, Director General of the Office of Population Planning, Family Planning, Socialist Republic of Vietnam; Dr. Jordan Musunguzi, Director General of the National Population Council, Republic of Uganda; and Professor Rizal Daimanik, Deputy for Research and Training, National Population and Family Planning Board, Republic of Indonesia. At the end of today's session, we shall adopt a call to action which reflects the salient findings of the deliberations of the conference session. Prof. Dr. Patrick Kadama, Director for Policy and Strategy at the African Center for Global Health and Social Transformation, will present the document. Then the Honorable Professor Habib Gedira, Secretary of PPD Board and President Director General ONFP of Tunisia and Chair of the Arab Council on Population and Development, will lead adoption on the call for action. Excellencies, ladies and gentlemen, in 2020, the United Nations Population Fund appointed the High-Level Commission on the Nairobi Summit on ICPD 25 follow-up. I was nominated as member of the very important commission by the PPD Secretariat. 2 weeks ago, the commission released its first report titled, and I quote, "No exceptions, no exclusions," close quote. The report focused on progress towards realizing sexual and reproductive health rights and justice for all. I would like to draw your attention to the report as it found progress on some of the Nairobi commitments. However, overall, it notes serious setbacks in sexual and reproductive health rights around the world as a result of the impact of COVID-19. The report calls for ambitious, deliberate, and comprehensive action to achieve sexual and reproductive justice for all, in particular women and girls. We should take stock of what needs to be done in our countries and how we can support each other throughout South-South collaboration to confront the setbacks. Ultimately, we need to take appropriate action that will benefit our people. Importantly, the Commission's report also highlights innovations born out of necessity that have kept services going and even offered new models that can be more widely replicated. As we have done through our PPD International Inter-Ministerial Conference this month, we have to continue sharing our best practices with each other because innovations that are developed in a developing country context are more likely to be useful to be replicated or adapted successfully in other developing countries. I thank you. Over to you. Thank you.